Well, COVID case numbers continue to climb at an alarming rate in Mississippi, with more than 3,800 new cases reported statewide today. The COVID crisis bringing to light new concerns about cancer patients during the pandemic. Colorectal surgeon Dr. Ramon Brown from Singing River Health System joins us now with more. Dr. Brown, thanks so much for being with us today. And of course, we've talked about this before, but this is really a growing concern, and certain issues are really starting to come to light from what I understand. The delayed treatments, delayed screenings are causing some more serious issues for patients. Are you seeing that?
Yes, ma'am. And good afternoon, and thank you for having me. So yes, we are seeing some delay in patient treatments. We're seeing patients present with later stage disease. Patients who have been having symptoms for several months, or at least from the beginning of the pandemic, who decided to hold off on treatment or seeking care, are now presenting in an emergent fashion, seeking care. In some instances when it's too late. I've seen patients who presented and ended up having COVID at the same time as a colorectal cancer. I've had some patients who presented for follow-up who skipped their chemotherapy entirely due to fear of contracting COVID by going to their chemotherapy appointments. So we're seeing a lot of delay in care and disordered care secondary to the COVID pandemic.
And I know, Dr. Brown, that from a lot of people I've spoken with, some friends dealing with cancer even, they were some of the first in line to get the vaccine, but you're actually seeing people who are dealing with cancer who are unvaccinated too, which is really creating bigger problems for them.
Correct. I have at least one known situation where a patient presented to me recently diagnosed with colon cancer, and not too shortly after being diagnosed with COVID, and then delaying care for that as well, and ending up in been mechanically ventilated for COVID. So this is a serious concern. Even those patients who do develop colon cancer, my recommendation would be to get vaccinated if you're not vaccinated, if you're going to be in a health environment. I think vaccination in general is an excellent way of helping us as a community stop the spread of the disease and prevent those who do get the virus from having significant or severe outcome.
Right, and of course the screenings and other treatments and testing so important too, to continue with that, because that's I know that elective procedures and those kinds of things have been delayed in many instances, but these types of things are crucial.
Correct. And luckily here at the Singing River Health System, we've been able to work with the executive team to find space for those patients who need their colon cancer surgery. Those surgeries are not elective, and via the state board's mandates, we'll continue to follow that, but patients who have colon cancer, we've been able to accommodate them in our system.
Yeah, people definitely don't need to delay that treatment, and we really appreciate you joining us today to bring this message home and to encourage people to get the vaccine. Another reason for people to get vaccinated, and also to stay on top of their other health concerns during this pandemic. Dr. Ramon Brown from Singing River Health System, thanks so much for joining us.
Thank you for having me.